Hi, everyone, and welcome to another episode of the Healthcare Connector, where we are working to amplify the voices of women and people of color in healthcare. Today, I have a very special guest, Ms. Terry McGuire. So I just want to jump right in and let the listeners get to know you. So tell us a little bit about yourself, what you do.
Sure. And thanks for having me. I am Terry McGuire. I am a physician assistant. I'm entering this is my ninth year of clinical practice. I
Mm.
attended Duke University for PA school. Before that, I attended University of North Carolina at Greensboro for my Master of Public Health degree and studied at Wake Forest University for undergrad. So I am from North Carolina and just traveled down 40 East
Mm-hmm.
to complete all of my schooling. I um, lived in North Carolina pretty much the majority of my life. I've now been in the DMV area for the past 7 years, and I am launching my business February the 22nd, 2022, Evolve Health and Wellness Community.
Yeah, so I want to hear more about that. So tell us, what is Evolve? Tell me about that name. Like, I want to know all the things.
Sure. So Evolve is a business where we are focusing on addressing and improving health literacy for individuals in an effort to advance health equity for people with marginalized identities. I never thought I would ever do this, start a
Mm-hmm.
business, but it really rested on me about a year ago, and it was
Mm-hmm.
something that I really couldn't shake. And like once I started to brainstorm about it, like the ideas just kept coming. And so I think it really has been years in the making. I'm incredibly passionate about it. I see so many communication gaps just clinically. I have so many family and friends who reach out to me and they're
Mm-hmm.
just having a difficult time like navigating the healthcare system. They have so many questions. It's like they've been to an appointment, but they still have so many questions. And so we know
Mm-hmm.
there's an issue like with time and how much providers really can devote like in a clinical
Mm-hmm.
visit. And a lot of things just get missed. So, you know, even though I'm not there, like people know that I have a clinical background. And so they call me about like, I have these labs done. Can you help interpret them? What does this
Mm-hmm.
mean? Do I need this medication? Can I hold off? Like, what alternatives do I have? And so, and sometimes you can really get some bad outcomes when these communication gaps happen. So
Mm-hmm.
that really kind of is the heart behind Evolve. And our tagline is navigating the peaks and valleys of your health and wellness journey. And
Mm-hmm.
so that's why the V is capitalized kind of
Mm-hmm.
to, go alongside that, because it really is just a lot of ups and downs. Our health
Mm-hmm.
it's a journey.
It
We'll have a lot
is.
of ups and downs as we age. Our body just doesn't operate the same way it did when we were younger. Um, so just really trying to help people. And again, like people with marginalized identities, we know like the statistics are
Mm-hmm.
there, how our health outcomes are subpar. We have a
Mm-hmm.
lot of work to do. So certainly just want to help individuals and organizations address this from both sides.
Yeah, and I think it's very important. Even for me, even someone who has somewhat of or has his background in healthcare, um, I just resonated with what you said about labs. Like I could just remember now, like going to the doctor, they're like, "Well, we're gonna send you your lab. You'll get your labs in your little
Yeah.
portal." And I'm like,
Yeah.
"But how in the world am I supposed to know what in the world do
Mm-hmm.
those labs mean? You just want me to click on the link and go see them." So I think that the
Mm-hmm.
service is definitely very useful. I was talking with someone also, so another point you made the other day about being able to have access to a provider that looks like you. Can you talk
Mm-hmm.
about how important that is, or how you've seen that improve the relationship between yourself and your patients?
Yeah, absolutely. It's almost like I see when patients come into the room that look like me, it's almost like their eyes light up.
Yes.
And it's a different experience. It's a different comfort level when, and again, like being a black or being a person of color, it's not monolithic, but there
Mhm.
are some shared cultural understanding and nuances that you can connect with. So It definitely just makes for a more comfortable space to open up to talk about some things that you're going through. Um, and I think there's less intimidation. And
Mm-hmm.
so it really just makes a difference for the patient to be able to disclose. And so you can kind of have more information to work with when you're trying to develop, when you're trying to complete your assessment and come up with a
Mm-hmm.
plan that's necessary for that patient. And then just continuity of care. So if someone sees you, they can connect with you, they feel more comfortable coming back. And that's really important for just
Mm-hmm.
following up if for your preventive care, if abnormal labs come back. Because I actually was talking to one of my friends recently, and she was saying she had a really bad experience at urgent care, and it really was traumatizing for her. And
Mm-hmm.
it impacts her wanting to go to the, medical office now for any type of visit. So
Yes.
it's really important because when you get turned off and when you're traumatized, it can have a long lasting effect.
Yeah, and I mean, it means a lot to be able to trust who you're going to for these information in these peaks and valleys and along this
Yes.
journey that you're
Yes.
on. So we
Mhm.
all know, like the last couple of years has been crazy, right? The healthcare is crazy, the world is crazy, and we hear a lot of talk about this great resignation, people leaving healthcare. What's made you stay in healthcare and sort of double down on it because now you create a healthcare business?
I really think that the business has given me some energy
Mm-hmm.
because honestly, like it does get very discouraging. And when COVID started, I knew it was a matter of time. Like when
Mm-hmm.
they said this was in China, I'm like, okay, this is a matter of time before it comes here. So I was kind of just like waiting.
Mm-hmm.
And it has been, it really just highlights so many issues with our healthcare system and
Mm-hmm.
a lot of those things that burn providers out. And so at the same time, I am passionate about it and I do
Mm-hmm.
like making a difference. And so that has helped me to stay even throughout all the other drama that
Yes.
goes on. But again, like Evolve really has it's just kind of like, I don't know, it's just been invigorating to do this because it has allowed me to really focus on my passion, be
Mm-hmm.
creative, and just almost like it's like a renewed energy.
Mm-hmm.
So that's just kind of been helpful for me, honestly, like through
Okay.
this all. Hmm.
So let's talk more about Evolve. So I love getting to hear, or part of this is also about showcasing people who are creating their own businesses, their own lane in healthcare. What's it
Hmm.
been like to start your own business? Because that's hard, because they don't teach you about starting a business
No.
in PA school or when you're getting
Mm-mm.
your master's in public health.
No. I mean, it is very hard. Like, I
Mm-hmm.
think to even just start, like, I had this idea and I'm like, okay, what am I going to do with the idea? So starting honestly was a big deal. And even, kind of the steps that I was going to take. And I talked to my midwife that delivered both of my sons, and
Mm-hmm.
we were just kind of talking about just like the challenges that we both experience as Black women in
Mm-hmm.
healthcare. And I was just like, well, if you know anybody that, is like a coach in this area,
Mm-hmm.
just let me know. And a couple of days passed, a few days, I can't remember how many it was, but she, sent me your information. And so
Mm-hmm.
I started to look and listen and kind of see like, okay, I like some of the things, that she's talking about. So,
Mm-hmm.
but the next question is, do you make the investment?
Yes.
And so, I was on a walk one day and I have what I call spirit guides. So like my
Mm-hmm.
ancestors, and I really seek them for guidance. And,
Mm-hmm.
I talked to my grandmother, she talks to me and,
Mm-hmm.
it was kind of just like, why? This question, why not?
Mm-hmm.
And so I was on a walk one day and I'm like, why won't I invest in myself? And so that was
Mm-hmm.
really a big challenge, is trying to get over that hurdle and like, okay, do I do this all on my own or do I get someone to help me through these steps? And so
Mm-hmm.
that was a big part. And then even like as you go through a coaching program, it's very challenging. There are tasks that you have to complete and there are deadlines. And so
Mm-hmm.
just trying to work all of that into your schedule. I'm still working full time. I have a
Mm-hmm.
young son and, marriage, all of the things that are on the plate. But I have, just shown up. I've continued to do it. And again, like it's really just exciting to be able to just have that creative energy. I don't necessarily have to, um, no one is telling me that I can't do it because I get
Yes.
that a lot,
Yeah.
in workplaces, like, no, you can't do this.
Yes.
No, your voice does not matter. But I'm like,
Yes.
okay, it does matter. I do have something to say and I can do it now with Evolve. So that really has just been, it's kind of just like, it's challenging, but it's also very, very exciting to just
Mm-hmm.
be able to tap into what I know I have inside of me and I can release it.
I love it. I was watching TV this morning and I heard her name's Danielle Brooks. She was on Orange is the New Black. She said you have to get to a point where your passion is bigger than your fear. And that's not what it sounded like.
Hmm.
You got to this point, you had your talk with your grandmother, and it's like, no, what I want to do is bigger than anything that is scaring me or anything that's
Yeah.
being put in my way. Um,
Yeah.
so I love it. Now, what should people come to Evolve for?
Yeah, so, I am a physician assistant. I have combined over a decade of experience in public health and, clinical background. So you certainly can come to me as it relates to any clinical matter. So if
Mm-hmm.
you just don't know where to start, so, it's an extreme. If you don't know where to
Yes.
start, but you want to get back into like healthcare appointments, just talking to someone about what options you have.
Mm-hmm.
If you have a difficult diagnosis that you're trying to navigate, also people who are caregivers and it's just you and you
Mm.
don't really know like what steps to take. I'm certainly here and available to kind of walk you through that to help break down some of the medical jargon, help you identify other resources that are available to you if you're not necessarily interested in a traditional medical approach. If it's acupuncture that you want to look into, if it's yoga that you want to look into. So it's really this broad, like this, it's patient focused if you want to just think about like medical type of things, but also
Mm-hmm.
just very holistic as well. And then
Mm-hmm.
organizations who, are healthcare startups, you're looking to be progressive, you've released statements around health equity, but you're not sure that you're quite meeting the mark. So you certainly can reach out to me. I can evaluate and see what things you already have in place, what written documentation you're giving to patients. During surveys to kind of get a better understanding of how clinicians feel or other ancillary staff about communication with patients. And then also trainings.
Mm.
I will do trainings using experiential learning, standardized patient style, so that
Mm.
you can kind of see firsthand how communication breakdowns, how communication gaps happen. There's so many different marginalized identities. So, it's
Mm-hmm.
not just black and white,
Mm-hmm.
it's
Yes.
so many, there's ageism, there's homophobia, there's transphobia. We have a lot of ableism happening. So there's so many different populations that need to be addressed and make sure that you're not missing them in your communication and make sure that that get no gaps, are open. So I am available again to come in, see what you have going on within your organization and how we can make steps to improve.
What are you most passionate about right now in your career, in your business?
I think, again, just making sure that um, communication is as seamless as it can be. I think
Mm-hmm.
communication is multi-layered. There's so many
Mm-hmm.
different aspects of it. And I just want visits to be optimized in the best way possible. I don't want
Mm.
patients to leave rooms and feel like I don't even know what just happened. but I have to
Yeah.
make decisions about my health,
Hmm.
because it's so, so important. And I know that if I wasn't as informed clinically, like even for my own healthcare visits, they would
Hmm.
not go as smooth as they do. And that doesn't mean that I don't have to advocate for myself. So,
Hmm.
that patient advocacy is very, very important. And, just making sure that learning for clinicians doesn't just end with your medical training. Like there should be continual learning, just like we do continued medical education. We
Hmm.
have to inform ourselves how it relates to different cultures.
Yeah, I'm so happy that you're doing this part around communication, because like communication shouldn't be a barrier that we're still having to address when we're in
Hmm.
2022. Like we've come up
Yeah,
with all these services and technologies and everything. So I should not be leaving my doctor's office feeling more confused than when I walked in. And so I do think that this is definitely a service that people need or need access to. Um, did
absolutely.
did you always know that you were going to go into healthcare?
I did.
Okay.
When I was a little girl, so I had started having seizures when I was around the age of 8. And
Mm-hmm.
then I had asthma growing up. So I was
Mm.
in the doctor's office and even was hospitalized for a while for my seizures. And so I just had this constant exposure to healthcare. My mom was a home health aide, and
Mm-hmm.
all of most of my family had some type of contact with the
Okay.
medical field. One of my sisters is a pharmacy
Mm-hmm.
technician, and another was a unit secretary in the hospital. So I just had a
Mm-hmm.
lot of healthcare around me. I grew up wanting to be a physician. Like that was, I think a lot of people have that story.
Yes.
And life happens and things don't always go the way that we think they'll go. And I learned about the PA profession during a program that I did over the summer at UNC Chapel Hill. And,
Mm-hmm.
so I got to see that there was other things in medicine outside of being a physician, and the
Mm-hmm.
other, areas that I was exposed to growing up. And so, I found it to be something that I wanted to pursue after studying public health.
What is a piece of advice that you would give to someone? Because part of this, this podcast being showing all the different things that you could do within healthcare. So for someone who's thinking about uh, going to PA school or going to get their master's in public health, what's a piece of advice that you would give them?
For me, just to be open, because honestly,
Mm-hmm.
I didn't even know that studying public health was something that I knew I needed. You hear people
Mm-hmm.
say I didn't know I needed that until I
That's.
actually got it.
Mm-hmm.
And it really just opened my mind, and I think it really makes me a better clinician. To just understand community health and so many factors that go into health outside of, this diagnosis and this treatment. Um, so I would say just be open. Don't necessarily um, close things off,
Mm-hmm.
because some avenues may enhance your journey, even if it's not
Definitely.
something that you expected or kind of have written out in your plan.
Mm-hmm. I
Yeah.
love it. So what's a challenge that you're facing right now, career, business, and whatever, and how are you facing that challenge?
I think fear,
Mm-hmm.
still, even though I've gotten started, fear still shows up.
Yes,
And
it'll show
so
up every
just,
day.
yeah, it's every day. And you just, some days are easier and you just kind of feel like you're on top of the world. I feel like, yes, I got this. Then
Mm-hmm.
there's some days like, oh my God, like, what am I doing? What have I done? I'm launching
Mm-hmm.
in a little, over 2 weeks. Like, so I really I talk myself through it. Another thing that Evolve does is offer Meditation Mondays.
Yes.
And meditation is something that I do often, and it really just allows me time to ground, to just, allow those thoughts to come. let them,
Mm-hmm.
have their
Yes.
moment of fear, but at the same time, okay, like how am I going to counteract those thoughts? How am I going to cope with this moment of fear?
Mm-hmm.
Because, sometimes fear can inform us, and sometimes it's just like a flat out lie.
Yeah. Yes.
So that's what I do. I love to journal. I write down notes to myself that I can revisit. Even though I'm facilitating these meditation Mondays, I go back to them to say like, okay, I'm struggling right now. I'm feeling a little bit anxious. Like I need some time to get myself together. So I'll go back. I'll revisit them. I love to read.
Mm-hmm.
And so those are some of my coping mechanisms. I like to take some walks and just, you know, be still and get myself better.
Where, hey, because I love your meditation Mondays. Where can people find them?
So they are on YouTube. So Evolve Health and Wellness Community on YouTube. Also on my Instagram page,
Okay.
Evolve Health underscore Wellness Community. And I'm also on LinkedIn. So I post them there as well.
Yeah, and I'll tell you also, I love the Meditation Mondays because social media, at least for me, has a way of like triggering my anxiety because we're just like scrolling, and you can see all these false narratives
Yes.
on social media,
Yes.
and people only really show like the highlights of their life. And so, especially as you're starting a business or even trying to grow in your career, you're just scrolling and it can become overwhelming. And so I know for me, I'm scrolling and I see the Meditation Mondays, and it's just like a chance to calm down, like you said, and a chance
Mm-hmm.
to recenter. So I
Yeah.
love that you're doing that on in that space to kind of
And
help
that's
people
another
stop.
thing. Yeah, that's another thing that I do is like I take social media breaks. That also is
Hmm.
helpful for my anxiety because like you said, like you're scrolling and you see all of this imagery, all of these words. And so I saw a
Hmm.
meme the other day where it was like, we are not supposed to know all these people exist, let alone their
You're
thoughts.
right.
So,
You're right.
the fact that we're just like so inundated with like all of this information all the time, it really can become overwhelming. And so
Hmm.
I try to be mindful when I can just feel myself getting to that place like, okay, I need to step away from this.
Yeah. Where do you see Evolve in the next 5 to 10 years?
Yeah, so as I was brainstorming Evolve, like it was, a very, very big dream. It is a
Hmm.
very, very big dream.
Yes.
I remember driving to work when I first started brainstorming, and I was like, "Oh, that building is for lease." So I was
Hmm.
already just like looking at buildings, like,
Hmm.
like where we can grow into, like where
So
we can
yes, I love
expand,
it.
like right now we're starting, like our services will be virtual for the most
Hmm.
part, and a hybrid when necessary. But, just expanding, one, our location, so being in a physical building,
Hmm.
a complex, if you will,
Hey.
and building our team. So again, I talk about just like we are focused on health literacy and addressing
Hmm.
that, but being able to grow a team and have like dedicated health advocates that can be, assigned where it's not just me doing all of the consultations, and also just having, space for acupuncturists,
Hmm.
yoga. That's what I would
Mm.
love to see, evolve in this complex with so many different services that, may be underutilized because people don't know about them or they don't have access, if there are financial barriers. So yeah, just expanding our services, expanding our team, our reach, all of that.
I hope you got that building on like a vision board or a piece of paper or something somewhere where you can see it. Because I know, I think I definitely know it's going to come true, but I think it is so needed as well.
Yeah,
Like the one
yeah.
place where you can go to have access to these type of services. Who's been your biggest supporter, mentor through this newest journey in your life, starting a business?
Um, I mean, I think there are so many
Hmm.
people. It's hard to really just pinpoint one. I have so many people that I draw from where they're,
Hmm.
they are living, they've transitioned. And one of the big things that stuck out to me, my uncle who I'm named after,
Hmm.
um, I never met him, but he passed a year before I was born, but he actually had his own modeling company. And so,
Oh.
the fact that in the 80s, he had
Mm-hmm.
his own company like is something that I really reach back to say like, wow, like that is really just inspiring. And people in my family was doing this like before I was even born. So that was a big inspiration. My family and friends are always very supportive of me. With COVID, it's really just been
Mm-hmm.
me and my husband pretty much like in our little
Every
COVID
day.
bubble. So he gets
Yeah.
to hear a lot of all of my passions and, give me some of his feedback. So he's been very supportive. I look at my son and he
Mm-hmm.
encourages and inspires me as I'm, trying to get to that place and see my dream come to fruition and just, hope that he can one day see that. So I have so many supporters. I have mentors from like
That's
previous, like,
mm-hmm.
programs that I've done that I reach back out. I had a lot of calls with people who are in
Mm-hmm.
this field before I even jumped in. So, it's a lot. It's a lot. And I don't want to start naming people and
Look.
then get in trouble.
Look, I was when you got finished, I was waiting to say it. I was like, perfect answer, Terry. Wait not to
Yeah.
call out one person
Yeah.
because you don't want to get those
No,
videos or
no.
message saying, no, why you
Mm-mm.
ain't say my name?
Okay. That's why I said family, friends, like you are included. Okay.
That encompasses all.
Yes.
Okay. So, 60 seconds or less. What is it that you want people to know about Evolve before we go?
Yeah, so Evolve, we're launching February the 22nd, 2022. We are on Instagram, LinkedIn, and YouTube. You will be able to book services. After that time, we are amplifying the fact and the need for increasing health literacy and advancing health equity for people with marginalized identities. If you are struggling in your healthcare journey and you need someone to assist you, I am here. Would love to work with you. Reach out, send me a DM, a message, and let's get started.
Yes, I love it. Okay, everyone that is listening, please go out, go follow Terry, share her message, her business with others that you know. This is a definite service that we need, as you said, as we navigate all those peaks and valleys through our healthcare journey. This is a
Absolutely.
service that you want to have on your side. So we thank you so much for being on the Healthcare Connector. This has been us amplifying another voice. Everybody, I will put all of Terry's contact information down in the show notes. So let's make sure that we support this woman of color in healthcare. And we'll see you all on the next episode. Thank you.
Thanks, Dion.